Hello, my name is Eliezer Montes and today I will be presenting some applications of fiber optics in medicine. With this, I will also be saying some of the challenges fiber optics bring on the subject. Let's begin by knowing why fiber optics is a good method to replace electric cables. As we have learned throughout the course, fiber optic cables have the same functions as electrical cables. They are able to power up different equipment and transmit large amounts of information. Unlike electrical cables that work with electricity, fiber optical cables utilize light to transmit the information. This is a great advantage since because of this, there's no chance of shocking a patient by mistake. Another big advantage is that the optical leads are very small and flexible. This allows doctors to use the devices on a small instrument such as catheters, which are used to insert on the genital organs to drain urine. At the right of this slide, there's a picture of one of these catheters. The small lids also help doctors during a closed body surgery to see where they are operating through a small camera and with a small flashlight. Fiber optic cables do not need any metal to work. They can use plastic or silicone, uh, meaning that the materials would not oxidize or get any corrosion through time. This means that if an equipment was utilized, it can be washed and disinfected for another use. If handled with care, materials that work with fiber optic cables will be able to last for a very long time. There are different types of sensors. Today I will be explaining and giving an example of three of these types: optical, physical, and chemical. An optical sensor is a device that usually detects light and it sends its reading in an electrical form. For medicine, several types of optical sensors exist. One of oximetry, another dilution measurement of flow, then laser Doppler velocimetry, and fluorometry as well. These are not the only ones. Pulse oximetry is a test used to measure the oxygen level or oxygen saturation of the blood. It is an easy painless measure of how well oxygen is being sent to parts of your body furthest to your heart, such as the arms and legs. Optical measurements of oxygen saturation depends on the difference in the absorption spectra of oxyhemoglobin and hemoglobin. Optical fibers help in a case such as having an MRI because psychological monitoring during an MRI is necessary to ensure the safety of patients when they are sedated, anesthetized, or unstable. It helps in the case that no metal should be on the body when an MRI is taking place. Do not emit any noise. On a study called Monitoring Heart Rate and Oxygen Saturation with a fiber optic pulse oximeter during MR imaging, they had a successful test using pulse oximetry during an MRI. This was in 1984. There is a method called dilution measurement of flow. It is used for measuring cardiac output, the same dual wavelength optics that are used to observe the concentration of injected dye in the blood. Indocyanine green is commonly used. It has subslides strongly at 805 nanometers. The isostatic wavelength of the oxyhemoglobin oxyhemoglobin absorption spectrum. The time variation of dye concentration can then be used to calculate cardiac output by the usual dilution technique, just as shown on the pictures. A laser Doppler velocimeter, or also known as the laser Doppler anemometer, is a type of interferometer who measures the velocity of objects using laser lights. Coupling optical fibers with the laser instrumentation allows the insertion of a fiber probe directly into blood vessels for observation of intraluminal velocity. A potentially useful application of direct fiber photometry is the observation tissue and blood luminescence. Fluorometry is another type of optical sensing. Fluorometry is an analytical technique for identifying and characterizing minute amounts of a substance by excitation of the substance with a beam of ultraviolet light and detection and measurement of the characteristic wavelength of the fluorescent light emitted. A more common sensor type is the physical sensor. For medical fields, they are mostly used to measure temperature, pressure, and radiation. Today, we will be looking at temperature and the pressure type. The development of implantable temperature sensors is an important goal in medicine because of the careful control of tissue heating required in the hyperthermal treatment of cancer. In order to reach this goal, the sensor and its leads must not interact with microwave field. Also, having the device at a small size is very important. Therefore, an optical sensor is ideal. One of the oldest and simplest types of temperature sensors consists of a layer of liquid crystals at the end of optical fibers. There's an example of how this liquid crystal work in one of these pictures. This and they are important because they have a variation of light at different temperatures when a specific wavelength is disturbing it. An interesting application of liquid crystal thermometry was in a catheter for blood flow measurement by the thermodilution technique. A pressure fiber sensor works by using a cantilever mirror. This one is attached to a membrane located on the side of a probe. This one causes light to emit from a central optical fiber to be reflected differentially toward either two light collecting fibers on each side of the central fiber, just as shown on this picture. The ratio of the light collected by the two apparent fibers is sent by the instrument, applying a feedback air pressure to the interior of the probe through a pneumatic connecting tube containing the optical fiber. With this knowledge, fiber optic transducers have been developed to monitor in cranial and in cardiac pressure. A very important application of fiber optics in medicine are the chemical sensors. The basic idea of a chemical sensor is of an indicator packing in a permeable container at the end of a pair of optical fibers. The four listed components, pH, which determines the acidity, phosphorus oxide, carbon dioxide, and glucose, are all measured with the same concept. A specific dye is used for each one of them, and depending on the spectrum that they emit due to chemical reaction, is how much the person has on their bodies. This is an important sensor since electrodes are not efficient enough to calculate chemical levels on the human body. Just as everything has very good advantages and ways to make things better, there is always a cost or disadvantage that one has to deal with. Fiber optic cables are not an exception. One of these disadvantages is that physical vibration will show up as a signal noise. Although many of the equipment that has been mentioned do not have to move, some of them do. This also does not allow fiber optics to grow more deeply in the medicinal field, since when making surgery or doing some other test, some equipment has to be precise, and noise may disturb all of the reading. Fiber optics are flexible, but they are also easy to break, meaning that they should be used with extreme care, especially since they will not transmit signals if they bend too much. Although money is not always an issue, in this case it is. Fiber optic cables are more expensive than electrical cables due to their low production, uh, even though this may change in a close future. These are the references that I used to uh, for this presentation. Fiber optic communication has allowed the medical field to advance and improve to a higher level. Although it has some challenges, it is better than electric cables in many ways for the safety of people. Different sensors have been made, being able to sense optically, physically, and chemicals inside the bodies. Fiber optics do not stop to evolve now; rather, it is only starting to change the medicine